The structures we're going to focus on for this topic is the head, face, neck, and regional lymphatic system. Let's begin with the structures that we're going to be assessing. When you walk into a patient's room, you already are doing a visual scan of that patient. Is the head symmetrical? Is the face drooping on one side? Is the neck lined? These early impressions matter. So, what might you suspect if a patient has a sudden onset of facial drooping on one side and can't raise their eyebrow and has their speech slurred? Well, that's right. It could be a stroke or Bell's palsy. So, the head includes the skull, a rigid bony box that protects the brain and special sense organs. We have cranial bones that unite at movable joints called, there we go, called sutures. And there's 14 facial bones that articulate the sutures, except the mandible, which has the movable temporomandibular or TMJ joint anterior to the ear, right here, which is going to be very crucial to understand whenever we start doing our physical assessment. Then there's the sublingual and submandibular salivary glands. We'll look at the glands on the next slide. So the temporal artery lies superior to the temporalis muscle, and its pulsation is palpable anterior to the ear. So this is this section right here. Then we also have sublingual and submandibular salivary glands, as you can see here, but those are on the inside. And then the parotid glands are in the cheeks over the mandible, and they're not normally palpable, only in certain cases, like the mumps will have enlarged parotid glands. And then the neck has, multiple lymph nodes here. We'll get into that. So taking a look at the neck, it's by the skull and mandible above, and it's above the maندrium sterni, the clavicle, the first rib, and the first thoracic vertebrae below. All of these features hold the neck in place together, along with nerves and lymphatics that are part of the respiratory and digestive systems passes through the neck as well. The carotid artery and internal jugular veins lie beneath the the sternomastoid muscle here. So behind this, you could feel the carotid pulse right through here on your neck. Okay. And then the external jugular vein runs diagonally across this muscle, which is about this way right here. So we can feel that when it's distended. Now, the thyroid gland is an important endocrine gland that straddles the trachea in the middle of the neck. The thyroid cartilage right here, okay, which is a small palpable nodule, lies above the thyroid isthmus. So we're going to place our fingers to palpate the thyroid right below the thyroid isthmus area, which is right here. We're going to put our hands right here to feel it. Feel the thyroid assessment. So the head and neck have a rich supply of lymph nodes. And here is a better picture of this. And this is a picture of thoracic drainage and how it flows down through the face and neck here. And when something is impacting that flow, we can have enlarged lymph nodes, or if we have infections, we can have enlarged lymph nodes. So we have the preauricular and anterior of the ear. Postauricular is posterior to the ear. We have the occipital, which is on the occipital bone, jugulo-digastric, which is right in front of that. Then we have supracervical lymph nodes right here. And then we have submandibular and submental right under the chin. Then we have deep cervical chain and posterior cervical chain of the lymph nodes. So here's a closer up picture. We have preauricular, postauricular, occipital, jugulodigastric, superficial cervical, submandibular, submental, deep cervical, posterior cervical, supraclavicular. And that's the order we're going to learn them in the lab. Now, pediatrics is all about milestones in development, and newborn skulls are very fascinating because did you know that the bones aren't fused at birth? And it takes a while for these sutures here to become fused together. So that way that allows room for the infant's head to grow during the first year. And then it will gradually ossify and become a hard bone. So if you're palpating an infant's head and feel a soft triangular space at the back, and that's the posterior fontanelle. Okay. And then if it should be closed by 2 months. The anterior fontanelle is the diamond shaped one that's on top of the head, and that is the anterior fontanelle right here. Posterior fontanelle is back here. Here it is on a different view. Okay. It should close by 2 years old, so anywhere between 9 months and 2 years old. And if a fontanelle is bulging in a calm infant, that could suggest increased intracranial pressure. And a sunken fontanelle, when dips in, on the other hand, can point to dehydration. At birth, the head is larger than the chest circumference, and the neonate's skull bones are separated by sutures and fontanelles, and then it gradually grows to adult size by age 6, and by age 10 or 11, the lymphatic tissue actually sees adult size and then slowly atrophies. So during infancy, that head starts to change in proportion as the trunk grows. The facial bones grow at different rates. For example, in toddlers, the mandible and maxilla are small and the nasal bridge is low. Lymphoid tissue is well developed at birth and reaches adult size by age 6. Adolescence brings facial hair in boys, starting on the upper lip, then the cheeks, and the lower lip and chin. The thyroid cartilage enlarges and deepens the voice. We have voice deepening. And kids have really big lymph nodes. So don't be alarmed if you feel mobile, soft nodes in a healthy 4-year-old. It can be normal. But in contrast, a fixed, hard lymph node might make us think about malignancy or chronic infection. Pregnancy changes everything, even the thyroid. So, mild thyroid enlargement is expected due to hormonal changes in pregnant females. That gland will enlarge slightly due to tissue hyperplasia and increased vascularity. In aging adults, facial bones and orbits around the eyes become more prominent, and facial skin sags due to decreased elasticity, decreased fat, and moisture. If teeth have been lost, the lower part of the face may look smaller or even sunken. Have you ever seen someone whose head shakes gently while talking? That's often a benign senile tremor, especially when combined with a protruding tongue. But be on alert if they report dizziness during neck movements. So this could compromise vertebral artery blood flow. So always ensure they move slowly. Headaches are a huge cause of lost work hours, but they're not all created equal. Headaches are a leading cause of pain and missed productivity. They're classified by type, and tension type is the most common, followed by migraines. And migraines are episodic or chronic. They can have triggers like food, stress, environmental, and these headaches can have significant impact on activities of daily living. So if your patient reports severe throbbing pain with nausea and sensitivity to light, ask about a migraine history. Let's say a 25-year-old presents with throbbing right-sided head pain, photophobia, and nausea. It sounds like a migraine, right? So let's ask about triggers, chocolate, stress, or even weather changes. If the pain is bilateral, meaning both sides, and it feels like pressure and worsens with stress, it's likely a tension type headache. So, when taking a headache history, ask about the onset, location, duration, and severity. So, you're going to do your pain scale. Also, assess for associated symptoms like nausea, visual changes, or sensitivity to light and sound. And don't forget to explore their personal and family history of headaches. Subjective data includes asking about headaches, head injuries, dizziness, neck pain, or limited range of motion, lumps or swelling, and prior surgeries to the head or neck. Each of these can reveal important clues for further investigation, so never skip the history questions. Ask about head injuries, surgeries, even birth details in infants. Forceps use it can impact the skull shape if they had used that during delivery. So ask the parents, has your baby been reaching developmental milestones? Because this could clue us into any neurological developments. For infants and children, ask about maternal alcohol or drug use, the type of delivery, whether vaginal or cesarean, or any complications like forceps use. Also check on the child's growth and development. For older adults, dizziness and neck pain are important to ask about. Always connect your questions to function. How are these issues affecting daily activities? Okay, that was the subjective questioning. So now we're going to do objective data. It's time to do your assessment. Feel the skull. Is it normocephalic? Are there any tenderness over the temporal artery? Start your assessment by inspecting and palpating the skull. Check the size and shape. Palpate the temporal artery and the temporomandibular joint, the TMJ joint. Next, inspect the face and assess for symmetry and expression. Watch for abnormalities like coarse facial features, exophthalmos, as seen in hyperthyroidism, changes in skin color or swelling, involuntary facial movements or tics that might indicate some neurologic conditions. Palpate tenderness in hardened temporal arteries. An older adult may suggest temporal arteritis, a medical emergency that can threaten vision. So, some facial cues would be note asymmetry. If one side of the face doesn't move, think cranial nerve 7 dysfunction. And remember, like Bell's palsy affects the entire side, and a stroke may spare the forehead. So, now it's time to do your objective assessment. So, inspect and palpate the head should be midline and symmetric. Test range of motion. Palpate lymph nodes, noting their location, size, and shape. Check the trachea. It should be midline. The thyroid gland is often difficult to palpate, but assess for enlargement, nodules, and asymmetry. You can use either the posterior or anterior approach. If it is enlarged, then auscultate for growth. This may suggest increased vascularity, especially in hyperthyroidism. So, if they cannot hold their head midline or turn it fully, then if they can't rotate it and it's painful, consider meningitis or nuchal rigidity or trauma. Always ask about previous injuries. Palpate the thyroid from behind or front. If it feels lumpy or enlarged, consider a goiter, nodules, even cancer. And if you hear a bruit over it, that's abnormal and may suggest hyperthyroidism. Measure an infant's head during visits up until age 2 and yearly until age 6. Head posture and control are important. A baby should be able to turn their head from side to side by 2 weeks old. Common birth related skull findings include capsucadium, which is edematous swelling that crosses the suture lines and resolves spontaneously. It's always from birth trauma. So, this is a caput circadium down here on the crown of this baby's head. It covers both suture lines like a cap. The other one is a cephalon hematoma, and it's going to not cross the suture lines. It's going to be on one side or the other, always from birth trauma. It's confined to that one space, and it can take a few weeks to resolve. Molding is the overriding of cranial suture bones during birth, and it resolves in a few days. Positional plagiocephaly or flattening of the head is often due to sleep positioning. So, educate the parents to do tummy time, rotate the head from side to side to avoid that flattening on the back of the head. Assess fontanelles for their size and closure. Assess Check for tonic neck reflex, which should disappear between 3 and 4 months. Check for facial symmetry, especially during crying. Asymmetry might indicate nerve injury or congenital issues. And if you hear a bruit over the temporal area in a child under 5, that's actually normal unless there are other signs present. Observe the infant's face for symmetry, swelling, and deformities. Parotid gland enlargement shows up just below the angle of the jaw, especially when the child looks up, then it's a little easier to see. You could use percussion with directly with your fingertips in infants, but auscultation may reveal bruits in children under 5 or in anemic children. These are typically systolic or continuous and heard over the temporal area. In the second trimester of a pregnant woman, she may develop chloasma, which is a blotchy, hyperpigmented area over the cheeks and forehead. It usually fades after delivery. The thyroid gland may also be palpable, and that is considered a normal finding during pregnancy. In older adults, temporal arteries may become more prominent and twisted. A mild rhythmic tremor of the head may also occur. This can be benign or it may include a tongue protrusion. Tooth loss can cause the lower face to appear small and sunken. Also, the neck may curve more to compensate for spinal changes like kyphosis. And when you ask the patient to perform range of motion, make sure you go slow to help prevent dizziness or falls. In older adults, prominent facial bones and sagging skin are normal, but if you see excessive asymmetry or fixed lesions, then definitely dig a little bit deeper. So, to summarize, inspect and palpate the skull for size and contour and note any deformities. Palpate the temporal artery and the TMJ joint. Observe the face for symmetry and abnormal movements, which reflect cranial nerves 7, the facial nerves function. Inspect and palpate the neck, checking range of motion, lymph nodes, and the thyroid gland. If enlarged, auscultate the thyroid for a bruit. Understand these normal and abnormal findings across the lifespan that's essential for safe and accurate nursing assessments. Make sure you also know your vocabulary for this section.